Hi all, today I am going to discuss a topic on tumor in the kidney, if you call more correctly kidney cancer. Okay. Usually it is in the middle age and late age we see, but to my surprise we are seeing in the very young adults also and pediatric the renal mass. Okay. So the pathology is different in that pediatric group, but of course the renal mass is a disease which can be cured. So let's see. What are the common symptoms which we come across in the clinic? One is, main thing is incidental detection. You know, nowadays ultrasound is widespread for so many various conditions like stone disease, vague abdomen discomfort. The first reachable investigation is ultrasound everywhere in India. So naturally, once ultrasound is done, the early lesions is picked up. So that is called incidental tumors. Okay. And very important thing is that if it is detected early and treated, 100% success rate is there. And you can preserve the kidney in the early stages. Second mainly symptom is hematuria. What is hematuria? Passing the urine and blood counts while micturating. So this is called gross hematuria with clots, which warrants some urgent attention urologically. Another type of hematuria is that there won't be gross, but it's microscopic. When the patient tests the urine for some other thing, there will be microscopic blood cells and we go for a scan and detect the renal lesion. Another symptom which we see is the vague discomfort in the flank area or swelling, lump can be felt in this area because this is the kidney positions. So if any vague discomfort or lump is felt, immediately get an ultrasound done, it will guide to the diagnosis. So these are the common symptoms. The causes which I find for the renal mass usually is smoking tobacco or using tobacco in any other form, because we have besides the smoking also we have other methods of using tobacco. That's also very dangerous. Heavy red meat eat is very dangerous. Occupational exposure to asbestos, cadmium, etc. leads to renal mass or malignancy. Clinically, one more thing I have found very much is that usage of hair dye, especially the ammonia content hair dye, which I found in the history, most of the history, patients will have renal mass or bladder cancer. So it is very much related to the chemicals. So how to proceed when you find the renal mass in an ultrasound? Of course, there will be basic investigations like urine, blood test, and special investigations like CT scan and MRI. So all this will stage the disease. A big revolution has happened in the recent decade in the treatment of renal mass or renal cell cancer or renal tumor. What's that? If we can detect early stage, we can preserve the kidney. There is no need to remove the kidney. So once a mass is detected, if properly diagnosed and treatment is done at the earliest, we can save the kidney in very big percentage. So we know that kidney is a bean-shaped structure, upper pole, mid pole and lower pole is there. So you have to remove only the tumor and preserve the kidney. Especially it's very important because nowadays we have diabetes, hypertension, a lot of disease affecting the kidney. So preserving the kidney is at most important. Of course, if it is beyond that large one, you may have to remove the kidney. But that's also good because if opposite kidney is normal, it's quite fair. He can lead a normal life. So nothing to worry. And another important thing I want to tell regarding the renal mass is that once properly done, what is partial nephrectomy where the tumor is removed or complete nephrectomy is done, majority cases the treatment is completely over. No need of chemotherapy, radiotherapy, etc. In some advanced cases, immunotherapy tablets are there. Of course, it's useful. I will share my experience in last 1 year or so. Data 1 year I am telling, we had 4 cases where the renal mass has gone through the main renal vein to the heart blood vessels and gone to the heart. So, in such case we have to do the combined procedure, removing the whole kidney and open heart surgery to remove the tumor. So, in such cases it is reaching in such an advanced stage because patient has neglected all the warning symptoms. So, I suggest you these are the sample investigation, and the disease can be picked up in all the, even at village level in India. So, whenever the symptom comes, just contact the nearby urologist and the treatment to be done at the earliest. Thank you.